redneck teens with massive machines, everybody living beyond their means, brotherly love from the messed up genes, nobody wants to intervene. The billboard screams your advertising.
Hi everybody, I'm Dr. Anthony James, and I'm bringing to you today lesson number 5 in our series on 49 systems of self-expression and healing following the book directly. So if you're in the online class, there's a copy of this book that you can open up as a PDF. And if you're in live classes, this is a textbook that we issued to you in class. And if you're in neither of those, you can buy this at beardedmedia.com on amazon.com. And we're going straight through it. Here today on lesson number 5, we're going to be starting on page 40, system number 34. But before I start that, I want to take a minute just to reiterate why we're here. I actually wrote this book, and the reason why I wrote this book was to give you an idea of different ways that you can take the SomaVeda Thai Yoga training, SomaVeda Integrated Traditional Therapies Thai Yoga training, and with an emphasis of specialization according to your nature and according to what makes you happy, okay? What makes you happy. Actually give you different ideas of systematically how you could have an emphasis that could be a whole business. It could be your whole counseling protocol. It could be 100% what it is that you really like to do, and for the community of people that you really want to work with. I wanted to give you some creative ideas of systems within a system. SomaVeda Thai Yoga is not just a system of chirothesia, marmasakitsa, hands-on, and or what some people might say is lazy yoga. It is not just a system of stretching, not by far. Part of the Ayurveda tradition of Thailand, and it's quite sophisticated. And so we have psychological, mental, emotional, nutritional, physiologic, orthopedic, chiropractic, if you will, because we also have in our traditional heritage traditions of bone setting and orthopedic alignment, skeletal, structural alignments for balancing what's called skeletal chi, okay, bone marrow chi. And so today we're starting on page 40, number 34, a SomaVeda, a system of psychospiritual mental health. All right, so let me just go through this. We're going to get right into it. SomaVeda is a system of psychological, emotional, and mental restoration and balancing, emphasizing reduction of sympathetic atonia and balancing metabolic activity. You'll notice the reference there to Wilhelm Reich, and we refer to Wilhelm Reich because he's an alternative psychological system, if you will, to the Freudian, Jungian, eugenics-based systems that came out of pre-Nazi Germany in the 1920s and the 1930s. And we believe that Wilhelm Reich's psychological system is more of a humanistic system. SomaVeda sees the expression of negative emotions, fears, phobias, anxiety, neurosis, psychosis, etc. as caused by or a symptom of disturbances in the body's energy system or matrix body. In fact, what we say is the cause of all negative emotions, fears, phobias, anxieties, neurosis, psychosis, schizophrenia, etc., are caused or are a symptom of disturbances in the body's energy system or matrix body. And when I say matrix body, I'm referring to the sum of all of the identifiable energy structures that we know of today. And that includes the pranic body, the chakra body, the tridosha, the meridians, all of the meridians, prana nadis, the breath body, the huna chords, like we see in the Hawaiian indigenous medicine, so on and so forth. Some of all of them, okay? The 5 koshas, we call the matrix body. So the varietal expression and manifestation of negative emotions are the effect or the result of the accumulation and the lack of resolution of past harmful karma, unresolved trauma, and sexual repression, patterns of which often begin in childhood. And so the idea is that the first chakra cycle is the first 7 years of life. And so from a point of karma, we've already been reincarnated, if you will, reiterated in our consciousness multiple times, depends on your age. And we divide these iterations, if you will, these karmic cycles, into 7-year cycles based on traditional Correlate astrology, which is a traditional astrology common to Thailand, which we incorporate in the SomaVeda system. The first 7 years are the most important. We call those childhood. And if there is trauma, if there is sexual repression, if there is illness and stress where the children are injured or stressed beyond their capacity to cope or understand, it sets up an imbalance in the physical tissue, which is then reflected in psychological, emotional, and mental states. It's also reflected in the organic health of the tissue of the body, the organs' health, the heart health. And of course, in Ayurveda, the brain is an organ just like any other organ. The brain is an organ just like your prostate is an organ, or just like your stomach is an organ. These fears, phobias, anxiety, etc. are the emotional presentation of toxicity and or deficiency, and we call this karma. Karma, the law of independent origination, and the idea that too much or too little of what you need or what you don't need sets up patterns of imbalance that can perpetuate indefinitely, and that's why all God's children need therapy. The symptom, voice, and or expression of armored or blocked chakra points, also known as lom, marma, trigger points, trap, block, stagnant, excessive, deficient prana or chi, okay? That they are the symptoms of the accumulation of these energetic imbalance. In other words, I can actually store an energy imbalance in my wrist. I can actually store an energy imbalance in my elbow. I can actually store an energy imbalance on the surface of my stomach. Additional mental and emotional disturbances can be described as the disequilibrium of Promiwihansi, or balance within the 4 divine states of mind, or the sometimes referred to as the boundless, unlimited, infinite states of mind: love, compassion, joy, and equanimity. And in fact, in traditional Thai and Buddhist psychology, Buddhist psychiatry, one of the assessment techniques was really to listen, to look at the client and the context of their life and just ask the question, do you see love? Do you see compassion? Do you see joy? Do you see equanimity? And if one of those 4 things was missing, or is missing, or is markedly deficient in relation to the others, or markedly excessive in relation to these others, that was actually a symptom of disease. And it was also a roadmap to helping that person to balance. So, for example, briefly, if a person, you look at them, you talk to them, you listen to their life story, maybe you know them, maybe you don't, and you come to the assessment that they're deficient in love, they don't have love in their life, they don't believe in love, they don't have love as a reality in their world, well, that's a symptom right there of a serious disorder. And so you would work with them to creatively come up with a way to introduce and to validate the feeling, the expression, the understanding of love, because we actually believe that love is, in fact, the most powerful force in the universe energetically. And same goes for compassion. Compassion being the practical expression of love. How can you practically express something that you don't have? And joy being the result of expressing or engaging in compassionate acts, thoughts, or deeds. And equanimity, or the balanced mind, the ultimate end result here of psychospiritual mental health objectives, is only possible in a milieu or in an atmosphere that is also qualitatively experiencing love, compassion, and joy. So if you have someone who's really sharp mentally, maybe genius, Einstein level genius, but they don't have love, compassion, and joy in their life, they're sick, there's something wrong with them. And so their genius of mental function, their cognitive function, will be twisted. It won't be humane. Something will be wrong with it. We see all of these as being treatable, correctable, and manageable with conscious, methodical application of the psychic, energetic, yogic, and meditative tools found in SomaVeda Thai Yoga, like tapping. Cause of all negative emotions is a disturbance in the body's energy system, which we can correct by bringing energy, attention, consciousness, breath, and pressure, those 5 things, to the person, to the issue, to their life, to their fears, phobias, anxieties, etc., etc. And the end result of that process is a reduction of sympathetic atonia, or the sympathetic overactivity, which is causing mental health issues. We also believe that nutrition, diet, and supplementation is a big factor in mentation, cognitive, mental function, and emotional health. In other words, if you are deficient, malnourished, and it could be anything from key vitamins, enzymes, and minerals, that there are certain cognitive functions that are enhanced by those and deficiencies in those, and you lack those cognitive functions. It could be pre or probiotics, which have huge impact on mental, emotional, and hormonal stability. The physical work and physical balancing that we do, the facilitated yoga therapy, has actually, through various mechanics, a humongous impact on mental and emotional health. If nothing else, it's truly, authentically, genuinely nurturing, which is a cure for minty. It's a cure for many forms of mental and emotional distress. The experience of unconditional love, compassion, and genuine, nurturing exchange. Now let's go to system number 35. So before I leave 34, let me just say it one more time. So you could develop a practice of SomaVeda where that is actually it. That's all you focus on is psychospiritual mental health. And you could advertise that. That could be your specialty. And you would be a boon to humanity. And you could be busier than you want to be all day for the rest of your life. System number 35. SomaVeda is a system of dosha balancing. Doshas is a concept which comes out of classic Ayurveda, Tibetan Ayurveda, classical Indian Ayurveda, Thai Ayurveda, Sri Lankan Ayurveda, Nepalese Ayurveda, Bhutanese Ayurveda, Burmese or Myanmar Ayurveda, Cambodian Ayurveda. You get the drift, right? It's a concept. And the tridoshas, or sometimes referred to as the 3 body types, in traditional Indian Ayurveda, all people are described as exhibiting the influences of the 5 elements, ether, air, fire, water, and earth. And these 5 elements, elemental constituents, actually make up everything that there is, also make up the constituents of our matrix and our tangible physical body. However, The balance of these 5 elements is different for each person and different for each person according to predictable patterns at each different stage of life. And I talked about the chakra life cycles. That's in another area of research, which we call Correlate astrology. But it's important. The 3 doshas, or the tridosha, are Vata, Pitta, and Kapha. Vata is the combination of the elements and influence of ether and air. Pitta is the combination of the elements and influence of fire and water. Kapha is the combination of the elements and influences of water and earth. And all of the doshas are present all of the time, just like all of the elements from which they're derived are present all of the time. However, not always the same, and not always in the same balance or proportion of influence. In SomaVeda Thai Yoga, we use traditional and other methods of assessment, from palpation to taking the pulse, the Vedic pulse, to attitudes and general disposition to determine the activity and balance of the tridosha, and then to apply corrective balancing techniques and methods to more optimally harmonize them, or to balance them, as it is commonly said. Now, a lot of these assessments for tridosha actually come from list. They're in the theory book, Ayurveda of Thailand, Religious Therapeutics, and Yoga Therapy. And they're in classical Ayurvedic texts like the Sushruta Samhita, the Charaka Samhita. These ideas of how you look at people to determine their elemental balance or imbalance, and how those are combined to give you these 3, if you want to call it, psychological, mental, physical, and emotional body types. And then there are therapeutic protocols that are better for one type than another. And in classic Ayurveda, when you do your assessments and you take the pulse and so on, you determine which of these tridosha, Vata, Pitta, or Kapha, are most out of balance with the others, and then you apply corrective and remedial measures to bring them all in harmony, all in balance, all in alignment. And you have psychological tools, energetic tools, physical tools, structural tools, because this is a holistic practice, and therapeutic interventions affect every part of the body. So anybody who says that they're doing a holistic therapy and they don't have mental health program, well, it's not holistic. Anybody who says they're doing a holistic or an Ayurvedic therapy and they don't have an outright physical therapy aspect to what they're doing, well, that's not holistic. If there's not a nutritional component, well, then that's not holistic. We're holistic. The main thing that I want you to understand about this is that having a practice which is primarily about assessing and then correcting the imbalance of these tridoshas is a tried and true practice, and is a practice of therapy that you could do the rest of your life, and you could have a successful practice, and you could help many, many people in many, many ways. And it's one of those all roads lead to Rome kind of thing. Eventually, you'll cover everything that you need to, nutritionally, emotionally, physically, structurally, functionally, supplementally, etc., etc. Now, on page 41, system number 36, SomaVeda is a system of self-healing. How about that? SomaVeda Thai Yoga protocols, when properly done, are as good for the giver as for the recipient. There are many positive effects of practicing for the giver. In fact, there are so many, one might be selfish and practices healing work for self-improvement alone. How about that? There's not many therapies that you would choose to do, or that people traditionally would choose to do, not because it was a job or not because it was good just for patients or clients, but that in fact just because of the positive benefits that would accrue for the therapist. That would accrue for the therapist is good for you as the person that you're trying to help. Practice can be a creative way of self-observation and bring awareness to the many different aspects of oneself. Now, the client becomes a mirror with the primary focus on how the giver is while working. What do you feel when you're working? What do you think or understand? What realizations and awarenesses are present that are in normal circumstances of life not easily grasped? In other words, when I'm working with my client, when I'm working with a patient, I have intuition and insight into my own inner being, my own mental process, insight into my own thinking, my own physiology, my own feeling world, my own sensate world that I can't get to any other way. We're famous for this. We're famous for it. What do you feel? Doing SomaVeda generates a positive sense of well-being, good posture, better structure and alignment, increased energy and facilitation of breath and prana, a compassionate expression and experience of shared metta, loving kindness, increased range of motion, increased circulation, meditative mind and state of being, reduced expression of negative emotions, less fear, less anxiety, less phobias and the like, stronger minds, healthier body, and enhanced resistance to disease, connection, communication, integration with oneself and one's community. Self-practice of Hatha Yoga, including practice of Rusi Dotan or Rishi Yoga and the Rishi Hand Yoga, gives the balance, strength, flexibility, and it should be strength that the TPP, tangible physical body needs. Oh my God. What other therapies are so good in relation to the health of the therapist? And in fact, there are many people who say that doctors and therapists are the sickest, have the highest rates of addiction, drug addiction, alcoholism, suicide, divorce, etc., because they're doctors, because they're therapists. We don't have that experience, and we've been around a long time. My primary school, for example, Putai Sawan, right about now is over 1,000 years old. We used to say it was 980 years old 20 years ago. Now it's over 1,000 years old, operating by the same management team. We don't have this experience that our long practice causes deterioration of the therapist. One of my primary schools is the Wat Po Southern schools of Ananta Suk and Wat Po and Ayurveda Vidyalaya and Putai Sawan. And in general, the Wat Po system doesn't have this experience. We have many, many practitioners who've been practicing full-time for 30, 40, 50, and even 60 years, and they're still practicing and they're healthy. Not many schools of therapy, if you will, therapeutic methodologies can say that. In fact, some systems, like massage therapy, for example, they're really kind of upfront about it. They say the average massage therapist starts showing symptoms of occupational disability within 3 to 5 years of starting their practice after they graduate from school. That's horrible. They become a patient in 3 to 5 years. We don't. We treat them, but we don't. Number 37, still on page 41, a system of co-facilitated Hatha Yoga. One more thing about 36, I keep skipping back and forth a little bit. I'm thinking about this in layers. But if you did nothing else, but you did your SomaVeda practice as a way of making a living, right livelihood, but your secret ambition was for you personally to be more healthy in mind, body, and spirit, that would work. That would work. That's why we call it right livelihood. It's one of the reasons. All right. SomaVeda system number 37, a system of co-facilitated Hatha Yoga. It is a system of co-facilitated Hatha Yoga called Marma Sakitsa and Kaya Sakitsa. The system of chirothesia, which is a religious therapeutic system of laying hands on people to impart divine energy. Co-facilitated yoga, when applied following Ayurvedic medicine principles, is termed yoga therapy, a guided practice of asana, pranayama, etc., giving one the benefits of any regular yoga practice. Over 1,000 essential asana or balancing postures are commonly practiced with clients. Oh my God, what a repertoire we have. Over 1,000 therapeutic asana that we do to co-facilitate a healing expression between us and the client, for us and for the client and for us. Remember, it's good for us as it is for the client. These postures are commonly practiced with clients. We facilitate, we co-facilitate, we guide, coach, and help clients go through yoga asanas. Even healthy people can benefit from doing yoga asanas. It's not about range of motion. It's not about how strong you are or how far you can go. Not competitive. We're not doing competition yoga. The asana are performed in a natural, non-ballistic, non-invasive, passive-assisted range of motion with emphasis on the breath. Let me say that again. Our co-facilitated asana, or balancing postures, are performed in a natural, non-ballistic, non-invasive, passive, assisted range of motion with emphasis on the breath. The breath is the primary motive force in facilitated yoga asana. The therapist has the option of facilitating postures in any of 5 completely unique attitudes of the body: supine, side lying, prone, seated, or standing position. I'm going to go back. So we have 5 traditional attitudes of the body. And that's how we divide these 1,000 essential asana or co-facilitated yoga therapy postures, postural applications, in the physical or the marmasakita aspect of our practice. I'm not talking about the nutritional aspect or the purely energetic aspect of this right now. I'm talking about literally facilitating yoga. So again, as I'm facilitating the client through this great repertoire of different classic yoga postures divided into 5 traditional attitudes. There is a 6th attitude, which is not so commonly practiced, but it is there. It's called standing. Okay? And I do so in a natural. Natural means that I'm not forcing anything, and I'm not straining, and there's no level of force that could cause an injury. That's very important because we practice this philosophy also, which is called ahimsa, which means to at the very least do no harm. Boy, what a difference in Western medicine that would make if doctors had to take an oath to do no harm. Oh wait, they do take an oath. It's called the Hippocratic Oath. But you know, it's like what you do when you graduate and before you get your license, and apparently quite a few doctors could care less. They're not only not entirely committed to doing no harm, they actually believe that it's accessible if they occasionally off their patients. You know what I mean by off their patients, right? Iatrogenic mortality due to malpractice, negligence, and adverse interactions of protocols, drugs, treatments, so on and so forth. Okay? Acceptable. Not acceptable for us. Now we're on page 42. System number 38. SomaVeda is a system of hands-free or walking yoga therapy, or it can be. It's possible to do entire flows in vinyasa without using the hands, thus saving hand stress and overuse for the therapist and practitioner. One of the leading causes of occupational disability in hands-on therapists, quote-unquote, hands-on therapists, is the fact they use their hands. So they're trying to do a lot of work with force and strength and compression without mechanical advantage. And eventually what happens is their hands start to die. They begin to have hypertrophy, which then begins to have inflammation and swelling, which then begins to compress nerves, which then begins to cause things like carpal tunnel syndrome, tennis elbow, frozen shoulder, military neck, low back pain. Oh, I could just go on. And also part of the problem is always working off a table, but doing so in such a way that you're at mechanical disadvantage, not the way we work on tables at all. But it is actually possible to do SomaVeda sessions and not actually lay hands on the client. If you don't want to touch them with your hands, you don't have to. Okay, you can use every other part of your body. Hands-free or walking Thai, Edawan Thai in our school, that's what we call it, elephant method, because it feels like an elephant's on top of you. And also because in the Karen Hill tribe people that I trained with in the Padang Karen village called Charlie Camp on the border of Myanmar and Thailand about 25, 30 years ago, they were Mahouts and they were elephant people, and they did forestry and handled lumber and so on, and they did this with their elephants, and they lived in houses elevated up high on stilts so that they could just go from their house onto the back of their elephants every day. And very interesting. I still have some good pictures of the villages, but one of the things that the Mahouts would do is every day when the elephants would come back from their working in the forest and in the jungle, is the first thing they would do is give the elephants a bath. And elephants really like to be clean, and they really like to take baths and get in the water and splash and play, and they do this with the elephants, and it's a form of bonding, okay? And then the next thing that they do is they go to where they feed the elephants and where they're going to bed down for the night, and they have really nice, kind of straw beds that the elephants are going to bed down on for the night. But before they call it quits, the Mahouts all get together, and with their chosen elephants, usually the older females and sometimes the younger ones who are learning, they lay down in the straw and the elephants walk on them. You might think, oh my God. It's not like it felt like an elephant was walking on you. It was an elephant walking on you. And I am so fortunate, I'm so blessed that I actually got to receive these elephant blessings and these treatments, these very traditional Padang Karen therapeutic protocol, which you can only do if you have an elephant, okay? And here's the thing. All right, an elephant's foot has a hard outer shell, now they're toenails, and it's really strong. It's really rigid. It's really hard. But the center of an elephant's foot, the pad of the foot, is as tender as the pad of your arch or the pad of the center of your foot. It's as soft as a baby's bottom, and it's equally as sensitive. So even though elephants are big, an elephant can actually feel a pebble under their foot or a thorn under their foot. And they're very delicate as far as the way that they walk. They don't stomp around. That's not what they do. They're very delicate. And they can place their feet as they're walking very precisely. Okay? So what the elephants would do is you lie down in the straw, and then the elephants would take turns walking on you, and they'd walk on your back, and they'd walk on your legs, and they'd walk on your arms, and they'd place their foot very thoughtfully on your body, and then they would kind of rock, giving you pressure. And then they would move their foot, and then they would rock and give you pressure. And the nearest human equivalent of this is walking on someone with your foot. I mean, palm pressing is similar, but, again, with palm pressing, I'm still using my hand, but I could use my forearm, my elbow, my knee, shin, thigh, my hip, my legs and feet entirely. I can lean on, I can perch on, and I can bring energy, attention, consciousness breath and pressure to the body of my client without touching them with my hands. And I can rotate them through postures. I can do many hundreds of different technical applications of facilitation of postures and pressure on energy lines, which we call sin lines. These walking techniques, these Thai techniques of walking on the client, reduce occupational disability for practitioners. So even if you work with your hands, if your hands get tired, if your hands get sore, just stop using them. You don't have to take off. You don't have to go get surgery. You don't have to put your arms in a brace. Just stop overusing them. The easy solution to repetitive stress syndrome disabilities is to stop that which is causing the stress, the repetition that's actually technically causing the breakdown. The hypertrophy, the atrophy, the neuralgia, the paresthesia. Just stop doing it. Walking reduces the impact of size disparity between practitioner and client. So if my client is 2-3 times my size, no problem. I've worked on professional athletes that easily were twice my size, easily were twice as strong, easily. World-class power lifters, for example, world-class bodybuilders. I've had clients in the past who were champion bodybuilders and world champion power lifters, and I turned them every way but loose and made them cry for their mommy. Why? Because I'm not trying to out-strength them, not trying to out-muscle them. I'm using gravity. And if I weigh normally 198 pounds, a little more if I'm soaking wet, if I stand on a point with just a little bit of motion on my heel, I can actually generate hundreds, maybe even 1,000 pounds of pressure per square inch. So no matter how big or how powerful or how strong the person is that I'm working on, walking is the great equalizer. It reduces the impact of size disparity. It emphasizes gravity, posture, position, and leverage over force or strength. In other words, it automatically works smarter, not harder. In practical terms, hands-free Thai means we use everything but the hands. We use the knees, elbows, forearms, shins, thighs, even the head. And by the way, you should always use your head when you're doing therapy. I shouldn't even have to say that, right? But I mean literally use the head. Not so much like head butting, but there are postures where we can lever and we can use our head as a fulcrum or as a focal point for pressure, and it's actually quite powerful. They're all useful tools in bringing energy, attention, consciousness, breath, and pressure to bear with the client. And notice always pressure is the last one. If I said those were 5 fingers of Thai, pressure is the little finger. It's the least important. The least important. It's not so much important how much pressure you bring to bear. In fact, in some ways it's not important at all. What's important is how. And it's important the consciousness that you bring as you apply the pressure, the breath that you bring as you apply the pressure. Standing, kneeling, leaning, perching, walking, sitting on the client to bring positive contact are all legitimate tools and techniques to be applied at any time. SomaVeda walking Thai Etawan method is characterized by applying broad, deep compression and decompression to reduce biopathy. It's a really interesting concept of how using non-specific broad and deep compression and decompression, which is another word for traction, can actually cause a restructuring in the body, in every segment of the body, from the skeleton to the soft tissue to the fascia and viscera to the alignment of innervation, lymphatic drainage, and psyche. Temple Grandin, you might recall that name, was a person who was severely autistic, who on her own discovered that broad, deep, non-specific compression actually reduced her symptoms of autism, and in fact did so enough that she could go to college and graduate with a PhD. How did that happen? How does that work? Look up Temple Grandin. You're going to get some ideas about how applying broad, deep compression and decompression techniques reduces myopathy, but also enhances cognitive facility. Cognition. All of the same benefits normally ascribed to conventional unlimited Thai are just as characteristic. One of the differences also is that clients tend to find the stronger yet less specific application of pressure more deeply relaxing. How about that? We refer to this deep relaxation as reducing symptoms of myopathy and or sympathetic atonia and or sedated. You will find if you use the hands-free or walking Thai yoga as a primary application of pressure that your clients will tell you that they find it to be more deeply relaxing than when you use your hands. Don't take my word for it. Do it and just be ready for the comments. The walking and not hands type of session, sedating effect, drive clients into deep states of relaxation and delta brainwave activity. Point work and more specific pressure methods are generally more stimulating or tonifying. We've actually tested this. I've actually, in the past, took clients up to EEG, okay, and then did sessions on them. And if I use point pressure, like neuromuscular type or acupressure type, they were more alpha theta. If I use more broad, deep compression, including literally sitting on top of the clients, I actually got more spikes into delta brainwave activity. Delta brainwave activity is significant because that is the brainwave activity that we attribute the restoration of cellular function. Got to have that delta brainwave activity. All right, still on page 42, session number 39, or SomaVeda, a system of therapy for the blind or visually impaired. I actually have some videos on my YouTube channel of one of our professors, Ajahn Dr, for the Sawankalok School of the Blind. Traditionally in our school, teaching blind people this methodology was in fact vocational training, and it's a traditionally validated vocational training for many hundreds of years. It's well documented in Thailand for at least 400 years. It's documented as a primary therapy of blind or sight disabled people in India for longer than 400 years. Thai yoga therapy is a traditionally chosen vocation for the visually impaired, as so much of the work is determined kinesthetically. Being blind as a practitioner implies no handicap or disability. Additionally, variations are practiced by those with various other disabilities, such as no hands and no legs. So if we're talking about persons with disabilities, well, I've had students who were missing one or both legs, part of a leg, all of both legs, part of an arm, all of an arm, both arms, and they've been able to successfully practice. So you could be missing multiple body parts and blind, and you could actually still do this work with a variation. And by the way, if that's your case, come to me. I'm happy to have you in class, and I will teach you the variations. In SomaVeda practice, once you've located the client, once you've located the client, okay, you then know where not only the client is, but where every part of the client is located. The thigh bone is connected to the knee bone, kind of thing. We're referring to Leonardo da Vinci's Vitruvian Man or Universal Man, which exemplifies the uniform proportion and symmetry of all of the body parts to each other. That if you can just find or identify any one body part, you can find and identify all of them. That's the way it works. We also quite often practice with blindfolds, because even if you're not blind, By wearing a blindfold when you practice, you actually bring an enhanced sense of consciousness to all of the other faculties. So even whether you're blind or not, this is a good exercise. So A, you could do this system as a blind person. B, you could do it as a handicapped person of any kind, missing body parts. C, of course, you could do it with people who are handicapped, and I've done this in rehab facilities occasionally for 30, 40 years. So as a blind person, sight disabled, sight impaired, visually impaired, or otherwise physical handicap, could you learn to do SomaVeda Thai Yoga, and could you then do that as a livelihood and be successful? And we know people who do, and yes, you could. So I want to recommend it. All right, moving along. System number 40, on page 42. SomaVeda is a system of beauty enhancement and Vedic aesthetics technology. Oh, this is actually one of my favorites. How many people engage in aesthetics or beauty protocols that are completely toxic, completely harmful, completely dangerous, even deadly, like liposuction, which has the highest per capita mortality of any elective surgical procedure, according to the American College of boy, I'll just lose my train here for a second, but the American College of Plastic Surgeons. They've actually determined, and they published many, many articles on this, that liposuction, which is for body shaping, body dysmorphia, overweight, but I don't want to lose the weight, I just want you to remove the fat from my body, body shaping, okay, is the most dangerous, deadly, has the highest mortality of any elective plastic surgery procedure. And yet, it's super common. Entire Thai vinyasa as well as breakouts are practiced, such as reflexology of the feet, the hands, neck, and shoulders, facials, detox or panchakarma, cleansing, purification, cleaning, scrubbing, oleation, steam baths, the use of herbs and aromatherapy. Thai yoga is seen to be at the cutting edge of health and beauty industry. Boy, if you go to the Thailand Health and Beauty Show, which usually is in the spring, they postponed it because of Corona this year, but if you go to the Health and Beauty Show, you'll find people from 100 countries in Thailand who want to learn more about the aesthetic applications of traditional Thai yoga and traditional Thai massage or Thai Ayurveda. Traditionally indigenous Thai Ayurveda claimed restoring the luster and vitality and shine or healthy appearance of the complexion and body as significant discernible outcome of successful treatments. Successful treatment protocols like the Therapeutic Day program with adjuncts, nutrition, supplements, emotional balancing, panchakarma, detox. The end result of this process is the client looks younger. The client looks younger. I mean, look at me. I'm 80 years old. Do I look 80? No, I'm just kidding. I'm just kidding. But I've been practicing for 40 years. I'm not deteriorated because of the practice. However, just because some of the Thai methods or techniques are accepted from the total repertoire does not make Thai yoga exclusively an aesthetic and superficial practice, nor does it take away from its energetic, spiritual, philosophical needs. Okay, so it's like the massage thing. Just because we rub on or touch people doesn't make what we do massage. Just because there are aesthetic value or benefits from receiving our treatments does not in and of itself make us exclusively an aesthetic practice. And also in this context, we correlate aesthetic appreciation of yourself, your own image, your own appreciation of your own image, being functional and healthy, as being part of what it means to be a healthy person in life. And so we feel it's okay. Another reason we feel it's okay to have this emphasis is because it keeps you out of surgery, keeps you out of Botox, keeps you out of other harmful chemicals and procedures, which will eventually harm you. So while you're working at trying to be more beautiful, and which we can help you be more beautiful and look younger, be more flush and healthy, more youthful, more vigorous because you're moving better, okay? We are not causing you harm. And there's no cancer that's going to be a result of our practice. You're not going to catch cancer because you're getting Thai protocols to make you look more attractive. And then the cool part about it is you could do the Thai just from that point of view to make you look more attractive. And that's all you did was an aesthetic approach to keep people out of surgery. You'll save lives. And you don't have to have liposuction. You don't save lives. And more than that, no drugs, no adverse side effects, and people will have better emotional health, better mental health, better organic function. The skin will be healthier. The skeleton will function better. Functionally in every way, they'll be more healthy. And this will make them look more youthful and attractive because they're healthier. You know, old sick people look like old sick people. Old people who are completely healthy do not look like old sick people. Get it? Okay, let's do at least one more. SomaVeda, number 41. SomaVeda is a system of correcting and balancing PTSD. This is one of my favorites. Post-traumatic stress disorder, or PTSD, is an anxiety disorder characterized by persistent, frightening thoughts and memories, or flashbacks of some ordeal or a terrifying physical or emotional event, a trauma, associated with serious traumatic events, and characterized by such symptoms as survivor guilt, reliving the trauma in dreams, numbness and lack of involvement with reality, or separation or isolation from reality, or recurrent thoughts and images. Persons with PTSD often feel chronically emotionally numb. PTSD is nothing to laugh at. Of course, we normally attribute this to our veterans, but are veterans the only people that experience PTSD? And the answer is no. Sexually traumatized children have PTSD. Battered women have PTSD. People who are racially profiled and who are treated badly by anyone, emotionally, physically, have PTSD. If you've ever been beat up in your life, you probably still have some PTSD. I don't know, when you think about it, does your heart race a little bit? Does your breath speed up a little bit? Do you get cranky? All the way to you get insane. Then you probably have PTSD. Indigenous Thai yoga can balance the disrupted parts of the body's energy system, thus separating the negative emotions and emotional aftermath energetically from the events themselves. The events which originally caused the storage of the trauma or traumatic event in the person's mind, emotions, and tissue via the process of emotional armoring. The nurturing and balancing touch brings the person home, so to speak, to the present reality of life. In other words, Ban Kwan, one of my teachers, used to say that the energy and attention that we bring to the client calls their Kwan, or calls their spirit home, tells the spirit to return home. That in traditional Thai and traditional Ayurveda, PTSD was defined as either a couple of different things. One was it was defined as a psychic invasion and or possession of an evil spirit. That was one. And the other was a consciousness which should be present has left that area of the body. In other words, Elvis has left the stage. And therapy was about moving on the harmful entity or energy construct, which you might call Pi-Ban, or evil spirit, right? Replacing it with a wholesome energetic continuum, and or by bringing energy attention, consciousness, breath, and pressure to a particular part of the body that is out of balance, that is suffering, that is stressed, that in fact you call the spirit home. The Quan comes back to that part of the body, or to the person altogether. Maybe their Quan has left their body entirely. That's a traditional way of assessing. And you call them home. It's like ringing a dinner bell. And, it's like, Dr. J, call me anything you want to call me, but don't call me late for dinner. So when you tap on me, when you pay attention to me, at that moment, I'm more conscious than I was a minute ago. And that increase in consciousness of the innate is always inclined to balance, to harmonize, and to correct imbalance. So we are balancing the disrupted parts. The nurturing and balancing touch brings the person home, so to speak, to the present reality of life and consciousness of current life, substituting negative emotional patterning with healthy, positive patterning. Although, not unusual for clients to have some degree of emotional physical catharsis, it is not a normal part of treatment design and represents an artifact of the powerful emotional release clients often experience both during and after a series of one or more sessions. Considering the state of the world and the prevalence of traumatic events in life, oh my God, that's more true now than ever in history, especially for soldiers and for survivors of violent physical or emotional abuse, a lot of which is going on right now. It's possible to design a practice entirely targeting these types of individuals, and I have former students and colleagues that this is all they do is advertise, promote, counsel, and treat individuals with PTSD, and they have thriving practice. And considering the lockdowns, corona, stay at home, and now that the amount of abuse, of spouse abuse, of domestic violence, of alcoholism, suicide, angst and stress over losing of jobs, and maybe, depending on where you live, fear of looters and fear of people who are exercising their constitutional rights to protest by burning your business to the ground, causing you stress, you will have PTSD. Well, you will also be the perfect client for the SomaVeda Thai Yoga therapist of the future. And this is something I really want to emphasize for ministers and counselors as an area of emphasis, and that I want you to consider how important it is and whether you have the gumption, whether you have the mental strength and emotional strength. You've got to work on yourself too, by the way. Remember, it's a system of self-practice, but if you're going to guide others into resolving their PTSD and post-traumatic stress disorder and past life trauma, then the starting place is to tap on your own issues. Get to it. I've written a book about this. Aside from the BET book, I have written the BET book, which gives a methodology, okay, and principles for the BET or tapping. But I've also written another book called Angel Speaks, The Art and Work of Crafting Consciousness. And I highly recommend it. It's a big book. It has like 19 chapters, and it has huge amount of information on how to resolve negative emotional issues, both for yourself and strategies for others. And it's a good starting place. I highly recommend Angel Speak. It's available on beardedmedia.com. All right, so I'm going to end this lecture today right here. I want to keep it fresh and moving, both for me and for you. And I want to say thank you very much. We're ending on page 43, System 41, SomaVeda, a system of correcting and balancing PTSD. We'll start the next video lesson, lesson number 6, on page 43, System 42. All right, thank you so much. God bless, and see you in the next lesson.
Billboard screams you're advertising beautiful creatures left to live. massive RV. All of these things have come to